there, I'm Josh. I'll be your student nurse today. First, we would start with co-wipe. That would be where I would check my orders, check for allergies, assess my patient, assemble my equipment. I would wash my hands, introduce myself to my patient. I would identify my patient using my two identifiers, provide for privacy, and then I would explain, educate, and evaluate. All right, today we're going to be doing our lung assessments as well as administering an albuterol inhaler. We're first going to be doing the lung assessment.
Okay.
Okay. All right, first I'm going to just take a glance at the front here and make sure, no abnormalities as far as anything that I can see. It all looks pretty symmetrical. I don't see any abnormalities. I'm going to go around back. I'm actually going to place my hands about like this to check for symmetry in the back. Is that okay if I touch you?
Yes, sir.
Okay. Alright, I'm going to come down here. And we're going to come about right here. We're going to leave a little bit in the... Let me turn this just a little bit. Okay. And then we're going to leave a little bit of skin here. Okay. Any pressure or anything?
No, sir.
No? Okay. Alright. Good. Alright. Well, I'm going to listen to your lung sounds posteriorly, okay?
Okay.
Alright. So when I ask you if you would just take a deep breath for me and let it back out, okay?
Alrighty.
Alright, will you take a deep breath for me? And let it back out. Okay. Alright, will you take another deep breath and let it back out? Alright. Okay, I'm going to come on this other side here. Alright, you do the same thing for me. Okay, let it back out. Alright, we're going to come down. Let it back out. Okay, can we do that again? And let it back out. Alright, I'm going to come to the side this time. Okay, and we're going to come down a little bit. Okay, do it again for me, please. Okay, this time I'm going to come all the way across. Okay, can you do it for me again? Okay, and I'm going to come up just a little bit. One more time. Okay. Alright, your lungs sounded good in the back. Now we're going to go to the front. We're going to, well, before we go to the front, I'll go ahead and I'm going to just kind of palpate your back. Okay, just kind of feel for any abnormalities that I can feel. Any pain or pressure?
No, sir.
Okay. Alright, I don't feel anything. Alright, so this time we're going to go and we're going to listen to the front. All right. You can exhale. Go ahead and exhale for me. All right, then we'll come down. Okay. Then we'll come across. Okay, go ahead and exhale. All right, your lungs sounded clear. Have you been feeling okay?
Yes, sir.
Okay, good. All right. The next step is we're going to administer an albuterol inhaler. Mr. Gregory, you actually do have one prescribed by the doctor. So we're actually going to use that one if that's okay with you.
Sounds good to me.
Okay. All right. So first we're going to do the 7 rights of the medication. You're going to want to make sure you have the right patient. You're going to want to make sure you have the right documentation, the right time, the right dosage. You're going to want to make sure you do the right technique, the right route, and then the right patient. So you're going to want the right patient, the right drug, the right dose, the right time, the right documentation, the right route, and the right technique. Those are your 7 rights of your medication. All right, so we're going to, it says here, inhale 1 to 2 puffs by mouth every 4 hours if needed for cough. So we're going to go ahead, we're going to check it. It says Provental HFA, which is albuterol sulfate inhaler. Are you pretty familiar with the inhaler?
Yes.
You are? Okay. Okay. All right, so we're going to take it out and we're going to make sure to check our expiration date, which it says June of 2019. Okay. And we're also going to check it with the box, make sure that, you know, it was put back in the right box. It is. Okay. So first I'm going to take this cap off here, and I'm actually going to clean it with an alcohol wipe to help prevent any germ buildup or anything like that that might have gotten stuck in the airway here. So we're just going to clean it off on the outside. Make sure we don't have any bacteria. Right, and then we're going to clean the inner part here. Alright, and we're going to allow time for that to dry. Then when we get done, we're also going to clean it as well, to make sure that we're not going to leave anything, no bacteria or anything on it, even though it is just your personal inhaler. Alright, I'm going to set that there. I'm going to get it to where it doesn't touch anything for sterilization. Did you want to rinse your mouth out first? Just kind of swish a little bit of water around for me. And then I've got a cup here for you to spit in. Okay, just kind of clean everything out there while the inhaler's drying. Alright. So, as you know, with this inhaler, you would want to shake it up really good before using it. So we'll go ahead and we'll do that. We'll make sure that the contents of the medication's good and mixed. Alright. Alright, I'm going to go ahead and we're going to give you a puff, okay? With this one, you can come do it out a little bit. Alright, open your mouth real wide for me. I want you to actually take a deep breath and exhale first. And then hold it, and then we're going to wait a minute in between. You can go ahead and exhale if you need to. Hang on, we're still waiting. Okay. Hold that as long as you can for me, and then you can go ahead and exhale. Alright. And with with the inhaler, if you have one that is, you have different inhalers, of course. There's some that are more of like an instant release, and then you have some that are more of a long-term release. If you have, say you was put on 2 different types of inhalers for some reason, you would want to make sure that you did the instant release first, and then you would want to do the long acting, because it's going to break up more in your lungs. Does that make sense?
Yes.
Okay. Any other questions about the albuterol inhaler?
No, sir.
No? Okay. All right. Well, that completes our assessment.